It's important to review your options at times because companies offer the same coverage just at different prices. And it's based on age, it's based on location, your zip code, where you live. Okay? So not every company offers the same price, but the plan is the exact same. So Plan F is Plan F no matter where you go. It's the same coverage, just the companies offer it
That was
different.
my question, and you're saying that it is a different price. That was
Well,
my
every
question.
company is different, Dolores,
No.
whether it's United
Yeah.
or whether it's Humana or whatever, they're gonna charge you a different price.
But I
That's
think
I'm
what
saying.
the
They have
terms
the
we're
same
getting, like a
plans.
Medicare supplement is a it's an apple is an apple, as a Medicare supplement is a Medigap. It's the same thing. They just the word they use Medigap is confusing, but we all know it as Medicare supplement. But I guess what I was trying to say is when you see the word Medigap, just think Medicare supplement. That's what I was trying to say. I wasn't trying to. They're not different plans. I just want you to don't get confused by that word.
I think
Yeah.
the confusion is that maybe she was thinking that she could go with Prudential and get something, or she could go with Medicare. And then
Oh.
that is what, you know,
I gotcha.
That's what I think.
Yeah, because I'm not representing any one company today or any product today, because we offer all the different products and services and companies. But what I was trying to just from the terminology standpoint, from an educational standpoint, is what I was trying to give it to. So I know it's confusing because the word Medigap is not commonly used anymore, but it is what shows up on some of these charts.
So coverage is the same under these different.
On Medigap, yep,
You know, if you have Plan F, coverage is the same.
Yep.
Premiums differ.
yep.
Why would anybody take anything that was more expensive than the next?
Just not knowing, right? So you you know it for me it's easy, right? Because I do the certifications every year. I work with beneficiaries every year, so it's easy for me to know. Like I know if you live in Oakland County, I know where to go, right? But if you're someone that's new to Medicare or been on Medicare, you know, not that long, it's tough to go through. I mean, you guys all know, right? It's tough to go through all those marketing materials and pamphlets that all these companies send you, right? Year after year after year
It's a
after year.
moneymaker is what it is.
It's difficult.
It's a moneymaker
Yeah.
depending on the company, that's
Yeah.
all there is. And when you're first going on, you
Right.
don't know which company to choose, you're totally confused.
Right.
It's all moneymakers.
Right.
So what you're saying is your company takes people in and will get them the best plan, no matter what it is in
Right.
regards to the supplemental insurance.
Yeah, we
That's
could
what you're
we
saying.
could do that. Yep, we could do that. Yep. But for today's purposes, what I see is a lot of times people will maybe go with what their friend has or their family member has or what their neighbor might have. When in all reality, it may be good to consult a professional and figure out, hey, what is actually the best plan for me based on my age, based on where I live. Because if my friend or family member lives in Tennessee or Texas or Florida or wherever it may be, it may not be the same, right? So in terms of price, so.
So it's sort of like buying car insurance, you gotta shop around.
Yeah, shop around. Yeah, exactly. Yep. So now we're going to switch back here. We're going to go on the other side of this chart, which is what we call Medicare Advantage. Okay, so some of us in here may have heard of Medicare Advantage. We may have a Medicare Advantage plan. And as I mentioned to you before, Medicare Advantage plan basically replaces your original Medicare, so it doesn't get rid of it, but it becomes your primary. Okay, very similar to a program that you may have had through your employer in the past or an individual policy in the past. And they work as HMOs or PPOs typically. Okay, so on an HMO Medicare Advantage, you still have to maintain, original Medicare Part A and Part B. So you can't, just because you go with Medicare Advantage, you can't get rid of A and B. You have to maintain that type of coverage. Okay. All the benefits are done through a private insurance company. So to some of the names that you guys had mentioned in here, the Blue Crosses and the Uniteds and the Humanas, they're done through a private insurance company, the benefits. Some of the plans have a zero monthly premium. Okay. So that's still in addition to what you're paying. Remember, Part B was roughly a 134 on average, so it's in addition to. So some of the plans have a premium as low as zero. There are co-pays and co-insurances that are part of that plan, okay? Prescription drugs are in a lot of cases included in a Medicare Advantage plan, okay? And on an HMO, you have to obtain on a non-emergency care from a network provider. So one thing about an HMO is that you have to stay within a network provider if it's a non-emergency, okay? And care is coordinated typically through a primary care physician. So you elect, when you pick the program, you elect a primary care physician to manage your care. That's kind of what an HMO is in a nutshell. And then in most cases, not all cases, once you pick a primary doctor, you will have to get referrals or authorizations to go see specialists. Okay, so that's how an HMO works. But in certain cases, it's a good fit for individuals based on their circumstances. You know, everybody in this room has a different circumstance. And so I don't think I would never say that there's a one size fits all, type plan. That's for sure. Okay. And then sir.
What happened since Trump got in and he took $587 billion out of our Medicare, Medicaid, and Social Security?
I know.
Does that mean all these bills are going to be going up?
Not that I know of at this time.
Because I'll never forget that.
Yeah.
The bill a bigger war.
Yeah, well, that's all our money, right? We all paid into that system, right? So, for sure. Now, in a comparison to HMO, there's also what we call PPOs, okay? PPO is a preferred provider organization. So just like any other Medicare Advantage plan, you have to maintain Part B's premium. But the nice thing about a PPO is that there's in and out of network providers. You don't have to stay in a network. Yeah, I know we started a little bit late. Yep, 5 minutes. Yep, you're good. Okay. And then you don't need a primary care physician. You have the freedom to choose your doctors and hospitals. Okay, and that's the nice thing about a PPO. You have the flexibility to go see who you want and who you please. Okay, which is nice if you travel. I know a lot of people that like to have a PPO if maybe they live in Michigan a few months and then they go down to Florida for a few months, or they go to Arizona for a few months, or California. That's kind of where a PPO is nice to have. Okay. Now here's some changes. We'll go through these changes. We've got 5 minutes here. One of the interesting changes this year, guys, is there's a new open enrollment period. The annual enrollment period is the same. So starting October 1st, you have the right to review your options from October 1st to December 7th. Okay? Once that period changes, you also have a new enrollment period. So from January 1st to March 31st, so I like to call it the test drive. If you pick a plan and you don't really like it, as long as it's between January 1st and March 31st, you can make a one-time change. So if you pick a plan and you're like, you know what, 2 months in, don't really like this plan, don't want an HMO, want a PPO, don't want a PPO, want an HMO, you can make a one-time change during this. It's the first time that we've done this in many years now. Okay, so keep that in mind for this year. So you got a little bit longer time if something didn't really go your way. The second big one is Part D, which we talked about, the donut hole coverage. Okay, so if you have prescriptions, you're taking prescriptions, it's important to review that this year. And the other third big thing, and one thing that a lot of people may have heard in this room, is that Medicare Supplement Plan F is being discontinued. Has anyone heard that it's being discontinued, Plan F? Okay, so Plan F, as of right now, according to this Medicare Access chip, is being discontinued on or after January 1st of 2020, okay? Now that is just for people that are turning 65. Okay, if you have a Plan F plan now, so here's the misconception. If you have a Plan F now, you can keep it. But after December 31st, if you were born after December 31st, 1954, Plan F won't be available, and we'll have to look at a different plan like a G or an N. Okay, but if you have F now, I get a lot of phone calls on that. If you have F now, you can keep it. This is for people that are older than December 31st or younger than December 31st of 1954. Okay, so that's something to consider if you're, you got a few years left. And then just the final updates here, guys. The therapy cap is gone. I won't go through all that. Medicare Advantage plans are now offering in-home help. Okay, companies are going to be able to have help some in-home help now. Telemedicine is going to become more and more important. People are starting to get care online now. Teladoc is one of the companies out there that does physician visits over the phone and internet. So those are interesting concepts. And then lifestyle support. Beginning in January, Medicare had the option to now cover meals delivered to the home, transportation, safety features, bedroom wheelchair ramp. So there's going to be more and more things added to these Medicare Advantage plans. Very similar to like silver sneakers, right? If everyone's probably heard of silver sneakers for the fit. Okay, so that's the type of Advantage stuff on there. So this is us. We'll wrap it up here because I know you guys we gotta get to the most social aspect of it. But this is my office, Health Markets. That's our office, my phone number, and then that's my location. So some of you guys had asked where I'm at. There's Big Beaver, Rochester Road. Can't miss us, right next to the Taco Bell. We're going to be sticking around here for a few, so feel free to come up. We got candy, pens, questions, whatever you guys need. We'll be around, okay? Good. Everyone good? Question? Okay. Thanks, Tess.